conférence de presse qui, aujourd'hui, on a avec nous la ministre des Services publics et de l'Approvisionnement, Filomena Tassi, le ministre de la Santé, Jean-Yves Duclos, qui est ici pour une deuxième fois cette semaine. On commence avec une déclaration des ministres et ensuite on passe à la période de questions.
Merci beaucoup. Bonjour à tous et à toutes. J'ai le plaisir d'être parmi vous aujourd'hui avec ma collègue, l'honorable Filomena Tassi, la ministre des Services publics et d'Approvisionnement. La docteur Tam et le docteur Njoo se joignent à nous virtuellement et seront disponibles pour répondre aux questions des journalistes. Thank you for being here. Today we want to update you on the COVID-19 situation and on the Omicron variant at this time. But first, let me turn to my colleague, Minister Tassi, whom I believe has some very good news to share with Canadians. Thank you, Minister Tassi.
Good afternoon. Merci. Thank you, Jean-Yves. It's my pleasure to participate in today's announcement. I acknowledge the land on which we gather is the traditional unceded territory of the Algonquin Anishinaabe peoples. Our government continues to help all Canadians bring an end to the COVID-19 pandemic. The confirmation of the Omicron variant in Canada this week is a stark reminder that we must remain vigilant in following public health measures, getting vaccination rates as high as possible, and pursuing new tools to help protect Canadians. And my department, Public Services and Procurement Canada, continues to acquire the supplies needed to keep Canadians safe. Given the reinstatement of mandatory testing for certain non-exempt travelers arriving in Canada, my department is working with manufacturers to secure more tests. And I can confirm that our existing contracts provide the flexibility to ensure that any increased demand can be met. Canadians are doing the right things to reduce the spread of COVID-19 and its variants in our communities, and our government continues to have their backs. Since Health Canada approved Pfizer pediatric vaccine for those aged 5 to 11, parents and children from across the country have stepped up to do their part. I had the honor of seeing the first shipment come into our country at the John C. Munro International Airport in my hometown of Hamilton almost 2 weeks ago. And I am happy to report that 2.9 million pediatric doses have since been received. That's enough to administer a first dose to all eligible children in Canada. And with today's new guidance from NACI on booster shots, I can assure you that our country has access to more than enough vaccine doses for all eligible Canadians. Getting your shot is still the best way to protect yourself and your loved ones. And keeping up with public health measures will help to slow the spread of the virus. We also know that access to effective, easy-to-use treatments is critical to reducing the severity of COVID infections and will help save lives. That is why I am pleased to announce that the Government of Canada has signed an agreement with Pfizer for an initial quantity of 1 million courses of its COVID-19 oral antiviral treatment pending Health Canada authorization. Pfizer initiated a rolling submission for authorization to Health Canada earlier this week. In addition, the Government of Canada has signed an agreement with Merck for an order of up to 500,000 courses of its COVID-19 oral antiviral treatment, molnupiravir, with options to secure up to 500,000 more pending Health Canada authorization, which Merck is in the process of seeking. I am extremely proud that one of the phase 3 clinical trials for molnupiravir has been taking place at Juravinsky Hospital in my hometown of Hamilton. This is another example of how Canadians have been stepping up to combat COVID-19. As soon as these drugs are authorized for use, the government will work on getting them to provinces and territories as quickly as possible so that healthcare providers can help Canadians who need it most. Surges in COVID-19 infections mean challenging times continue for all Canadians. So we must continue to follow public health guidelines, and we must keep the vaccination effort going. As Minister of Public Services and Procurement, I will keep working to ensure that we have the supplies Canada needs to finish the fight against COVID-19. And our government will continue to do whatever it takes to keep Canadians safe and healthy. Thank you. Miigwech. Merci beaucoup.
Merci beaucoup, Filomena. Nous savons que l'accès à des traitements efficaces et faciles à administrer est essentiel pour réduire la gravité des infections dues à la COVID-19 et que cela pourrait et sauve effectivement des vies. C'est donc avec beaucoup de fierté que nous annonçons aujourd'hui que le gouvernement du Canada a signé une entente avec Pfizer pour une quantité initiale de 1 million de doses de son nouveau traitement antiviral oral contre la COVID-19 en attendant l'autorisation de Santé Canada. De plus, le gouvernement du Canada a signé un accord avec Merck pour obtenir jusqu'à 500 000 doses de son nouveau traitement antiviral oral contre la COVID-19, le Molnupiravir, avec des options pour en obtenir 500 000 de plus en attendant l'autorisation de Santé Canada. Dès que l'utilisation de ces médicaments sera autorisée, notre gouvernement s'efforcera de les acheminer dans les provinces et les territoires le plus rapidement possible, afin que les fournisseurs de soins et de santé puissent aider les patients qui en ont besoin. C'est une excellente nouvelle et un outil de plus dans notre lutte contre la COVID-19. Let us now turn to the measures we've recently put in place, which are intended to mitigate travel-related spread of the Omicron variant in Canada. Permettez-moi de commencer en faisant un bref récapitulatif des mesures annoncées depuis vendredi dernier afin de ralentir la propagation du variant Omicron au Canada. Last week, we announced that foreign nationals, whom within the last 14 days have traveled to a list of 7 countries, will not be permitted entry into Canada. On Tuesday, we added another 3 countries to the list, and those changes went into force on Wednesday. We have also announced that all fully vaccinated travelers arriving by air who begin their flight journey at any country other than the United States will be subject to arrival testing as well. This last measure is being progressively implemented, but let me be very clear. All travelers should expect to be tested upon arrival and should be ready to isolate. It will take a few days before we are able to test all targeted travelers, but we are ramping up our capacity quickly and testing more and more travelers every day. Je vais maintenant répéter en français. La semaine dernière, nous avons annoncé que les voyageurs étrangers qui, au cours des 14 derniers jours, ont passé du temps dans une liste de 7 pays, ne pourront dorénavant plus entrer au pays. Mardi, nous avons ajouté 3 pays à cette liste et ces changements sont entrés en vigueur mercredi. Les Canadiens qui ont voyagé dans l'un ou l'autre de ces 10 pays au cours des 14 derniers jours doivent maintenant se soumettre à un test à l'arrivée, en plus d'un test pré-embarquement, et ils doivent faire une quarantaine de 14 jours et subir un autre test le jour 8. Nous avons aussi annoncé que tous les voyageurs aériens qui ont entamé leur voyage vers le Canada en partance d'un autre pays que les États-Unis devront dorénavant se soumettre à un test à l'arrivée et s'isoler en attendant de connaître le résultat du test. Cette mesure fait l'objet d'une mise en œuvre progressive, mais soyons très clairs. Tous les voyageurs doivent être prêts à être testés à l'arrivée. Il nous faudra quelques jours avant de parvenir à être en mesure de tester tous les voyageurs ciblés, mais déjà, nous faisons des progrès rapides à chaque jour. Je l'ai dit mardi et je le répète aujourd'hui, nous ne pourrons pas tester tous les voyageurs ciblés du jour au lendemain. Cela va prendre quelques jours, mais nous allons progressivement augmenter le nombre de voyageurs testés jusqu'à ce que les infrastructures nécessaires soient en place pour tester tous les voyageurs ciblés par les mesures annoncées. I said it on Tuesday and I will repeat it again today. We will not be able to test every targeted traveler overnight. It will take a few days until the necessary infrastructure, space, and human resources are in place. As of December 1st, the Government of Canada started an incremental increase in the approach to testing on arrival for fully vaccinated travelers. Testing rates will continue to increase until the infrastructure is in place to test everyone. Officials are working closely with airport authorities, airlines and testing providers, and many other partners to increase capacity at airports, manage traveler flow, and to make sure that the testing protocol is as efficient and quick as possible. In the meantime, I encourage all Canadians to think about how these new rules may impact them and their families and to begin to prepare for when they are fully in place. We have already begun to ramp up testing towards 100% of all travelers coming by air from countries other than the United States. I would also like to remind all travelers, Canadians and foreign nationals, who travel by land, air, or water for long or short trips to submit their health and travel information in the free ArriveCan application or website before arriving in Canada. This is mandatory. Foreign national travelers who don't submit their information through ArriveCan may be denied entry into Canada. Canadians who don't submit their information via ArriveCan won't be eligible for exemptions and may face additional delays at the border and be subject to fines. There is much we do not know about this new variant, Omicron. Health Canada is working with manufacturers, international regulators, and the World Health Organization to assess the potential impact of this variant on the effectiveness of approved test kits, vaccines, and treatments. Plusieurs questions demeurent au sujet du variant Omicron et Santé Canada travaille avec ses partenaires et avec l'OMS afin d'évaluer les impacts potentiels de ce nouveau variant. Ce que nous savons d'ores et déjà, c'est que l'outil le plus efficace dont nous disposons demeure la vaccination. Et je me permets donc de le répéter, si ce n'est pas déjà fait, s'il vous plaît, faites-vous vacciner. What we do know is that vaccination remains one of the most effective ways to protect our families, our communities, and ourselves against the variants of COVID-19 currently circulating on our planet. In short, if you haven't already, please do get your shot. Earlier today, the National Advisory Committee on Immunization updated its recommendations to provinces and territories on the use of booster doses for people 18 years of age and older. Ces recommandations du comité tombent à point et nous permettront de procéder rapidement à la vaccination des personnes admissibles afin de protéger encore mieux nos familles et nos communautés. Thanks to our strong procurement strategy, we will be able to quickly deploy those booster shots and provide an additional degree of protection for Canadians. Now, let me say this again. If you are eligible, please get your booster shot. Encore une fois, je répète, si vous êtes admissible, faites-vous donner votre dose de rappel rapidement. Finally, I would like to remind all Canadians that in addition to vaccines, other public health measures continue to be an essential part of our collective fight against the virus, in particular in protecting us against community transmission. Wearing our mask, washing our hands, and following public health guidance remain key priorities. Minister Tassi, the doctors and myself will now be ready and happy to take your questions.
Merveilleux. Thank you. So we'll start a question period with priority to those of us who are in the room. If we do have time, we'll go over to the phones. So as a reminder, one question, one follow-up, and please refrain from asking the ministers to auto-translate themselves. We'll start out with off with Mackenzie Gray, CTV News.
Hi, Mr. Duclos. Can you give the medical rationale as to why international flights from all other countries, you have to be tested and there's potential quarantine rules, but for U.S. flights where looks like there's community spread in the U.S. and a number of cases there, the same restrictions don't apply?
Well, there will be community spread in the U.S. at some point, but there is none which is of significant magnitude at this time. We are working obviously very closely with our American friends. I've been in contact with them over the last few days. We know that this is a matter of common interest because of our land border, and we'll follow not only public health advice, but we'll follow up with those discussions and considerations with our U.S. partners.
There were a number of conversations that have been going on about the land border with the U.S. And whether or not rules have been applied there in terms of the one-day test and quarantine. Have you had any conversations with your counterparts in the U.S., and can you give clarity to Canadians if they're driving across the border what the situation would be there?
Yes, we've exchanged on that. Two things here. First, no, we're obviously in the ideal world would like to have common measures that would simplify a lot of things, including the confusion that Canadians can sometimes naturally feel when it comes to planning and having a trip across the American border. The second thing, however, is that we have different countries, different environments, different public health advice and public health institutions. And I think we've been quite successful over the last 20 months in demonstrating that we've had a strong set of border measures to protect the health and safety of Canadians. So I believe, and that's what we hear from public health officials, that what we've announced last week on Friday and on Tuesday is currently the best set of measures, given the necessity and the capability with which we are facing when we deal with these issues.
Laurence Martin de Radio-Canada et ensuite ce sera Marika Walsh du Global Mail.
Vous avez dit que pour les voyageurs donc, qui arrivent des États-Unis, pour l'instant, il n'y a pas de test à l'arrivée puisqu'on n'a pas la capacité au Canada de le faire. Mais j'essaie de penser, par exemple, est-ce qu'une famille canadienne qui prévoit d'aller aux États-Unis dans le temps des fêtes, à Noël, par avion, est-ce qu'elle peut s'attendre à ce que dans quelques semaines, à son retour, il y ait des tests à l'arrivée? Parce que ça a des implications, évidemment, pour le retour au travail, le retour à l'école, si les gens doivent s'isoler en attendant le résultat de leur test, et ça pourrait prendre plusieurs jours.
Il y a deux choses qui peuvent changer. La première, c'est que les mesures que les Américains imposent aux étrangers qui entrent chez eux, ces mesures-là peuvent évidemment changer. Elles ont changé hier et elles pourraient continuer à changer au fur et à mesure qu'on observe à travers le monde une évolution de la répartition du variant Omicron. Et la deuxième chose qui peut effectivement changer, ce sont les mesures canadiennes pour le retour au pays. On a vu au cours des derniers jours que la COVID-19 est toujours là et que les conditions de cette COVID-19 peuvent effectivement évoluer rapidement et que par conséquent, les mesures de tests et de quarantaine peuvent aussi évoluer rapidement.
Mais est-ce que c'est votre intention dans les prochaines semaines d'imposer ces tests pour les voyageurs qui arrivent des États-Unis par avion?
Bien, on va toujours avoir comme objectif de simplifier la vie de tout le monde. L'objectif n'est pas de rendre la vie des gens plus compliquée. On sait que c'est déjà difficile avec la COVID-19 au pays. Et il y a des personnes qui, parfois pour d'excellentes raisons personnelles, de compassion ou autres, ont besoin de voyager. Ceci étant dit, l'objectif principal avec la COVID-19, c'est d'assurer la santé et la sécurité des gens au pays. Et lorsqu'on a besoin d'imposer des mesures à la frontière pour atteindre cet objectif, puis on va le faire.
Dans les prochaines semaines?
Bien, là, il y a pas les objectifs sont, c'est ça, c'est de garder la vie la plus raisonnablement soutenable pour les familles et les passagers. Mais le deuxième objectif, c'est de s'assurer que la santé et la sécurité des gens, c'est maintenu. Et on ne peut pas donc prédire l'avenir. On doit tout simplement continuer à suivre la situation.
Good afternoon, Minister. Can you please clarify if the on-arrival test and isolation that Canada has also applies at the U.S.-Canada border for people who have been in other countries other than the U.S. in the last 2 weeks? And can you please also clarify if the people who are currently being tested at the airports when they arrive randomly, if they're being told to isolate while they await their test result?
Thank you. The first question, so people coming from outside of the U.S., transiting through the U.S. by an airport and entering into Canada by an airport, those are subject to the same rules as the rules that apply to people flying from elsewhere than the United States into Canada. So the same rules for those traveling from London, Britain, directly to Toronto, as the same rules for those as those that go from London, New York Airport, and Toronto Airport. Now, for the application of the measures, the testing, and the obligation to quarantine, those measures are being ramped up. So it's important for people to expect that they can be tested and that they can be asked to isolate and when they receive those tests. And as I said, we are ramping up significantly the capacity. I was just told a moment ago that since Wednesday, we have increased by 60% the testing capacity in airports in Canada. So this is fast. We still have a way to go, but we'll get there.
Sorry, and on the land border, if you're crossing from the U.S. into Canada at the land border and have been in Costa Rica or Jamaica, do you also need to be tested on arrival and then told to isolate, or at the land border, does that not exist? And when will this fully be in place that all travelers at airports are told to isolate pending a test result?
Good. Two questions and two answers. First, we are focusing on airports. So we are not increasing testing capacity at the land border, but there is testing capacity at the land border. Two types of testing capacity and operations. First, for those that come into Canada, and there are very few of them now that are not vaccinated. These are tested, all of them, at the land border. And there is a level of mandatory random testing applied at the land border for those that cross from the United States. So there is testing, but no intention at this time to move away from our focus on airports. So that's what we are going to invest our resources in, because that's what public health officials are recommending. And I forget your second question.
When will it be fully in place?
Okay,
well, you say that it's already happening, but it's very confusing for travelers who still don't really understand what to expect. So what is the date that this will fully be in place, no matter where you are flying into in Canada?
Well, we've said that from the very start. On Tuesday, we tried to answer a similar question. So we said that this would be ramping up over time and across the country. As I mentioned just a moment ago, over time, the ramping up is quite fast, now 60% in approximately 2 days. But the speed varies with airports. There are some airports where we can do that more quickly because there is excess capacity, excess test capacity. There is space at the airport, and there are human resources able to assist. Other airports, it will take a bit more time.
Merci. On passe à Raymond Filion de TVA. Ensuite, ce sera Mia Rapson de Canadian Press.
Merci. Bonjour, M. Duclos. Pour poursuivre dans la même lignée, pouvez-vous nous dire à quels endroits les tests sont actuellement faits dans les aéroports? Est-ce que c'est le cas, entre autres, à l'aéroport Pierre-Éliott Trudeau de Montréal?
Oui, il y a des tests qui se font, qui se font depuis plusieurs mois à l'aéroport Trudeau.
Cette annonce de mardi, là, pour les gens qui reviennent des pays...
Oui, il y a des tests qui se font à l'aéroport Trudeau. Il y en a qui se font dans tous les autres aéroports où les voyageurs étrangers entrent. Et à Trudeau, comme ailleurs au pays, la capacité de tests a augmenté parfois significativement au cours des derniers jours.
Tu sais où les choses peuvent changer. Quel est votre conseil aux gens qui prévoient des voyages? Est-ce qu'on est mieux d'annuler? Iriez-vous, vous, en voyage avec votre famille sur une plage dans les prochaines semaines?
Bien, c'est une décision personnelle. Il y a tellement de considérations personnelles et tellement de conditions variées à travers les gens qu'il serait inapproprié pour moi là, de juger des choix personnels. Toutefois, ce qu'on peut dire et ce que les gens savent, c'est que la situation peut évoluer très rapidement. Il y a une semaine, on ne connaissait pas le variant Omicron. Il y a 2 à 3 jours, on a annoncé ces mesures là, qui ont un impact évident sur l'arrivée dans les aéroports du pays. Alors, on espère tous que ça va aller pour le mieux, mais il faut être conscient que ça pourrait aussi être de plus en plus compliqué pour les gens au cours des prochaines semaines. Ce n'est pas ce qu'on souhaite. Et les mesures que l'on prend maintenant vont aider, je crois, là, pour garantir que ça aille le mieux possible au cours des prochaines semaines.
Hi, good afternoon. I'm wondering, most provinces have already decided what to do with boosters. They've already started doing it weeks ago. Why did you feel it was important to ask NACI this week for very fast advice on boosters when most provinces had already made their own decision on it?
Well, for 2 reasons. The first one is that the international views on the use of boosters, these views have evolved over the last while, with the last days and weeks, and NACI and PHAC in particular are well positioned to incorporate these international views and to digest them in the context of Canada. And the second thing is that there is a significant level of variability, heterogeneity across Canada in the way in which provinces and territories are moving or not moving on the boosters, and that can create confusion. You know, Canadians watch the news and read the newspapers and sometimes don't really know why their province is positioning itself differently from other provinces and territories. So there is no intention of imposing a one-fit-for-all set of measures when it comes to boosters across Canada, but I think there is a need, and I would say even a responsibility for NACI at the federal level to help provinces come closer together in answering the questions of Canadians around booster shots, and eventually having perhaps a more greater harmony, greater coherence in how provinces and territories move forward.
Canada's banned travel from 10 African countries at this point, but Omicron has actually been found in 38 countries, at least worldwide, according to the World Health Organization today. And there's a lot of evidence that suggests testing, rather than travel bans, has a bigger impact on preventing the spread of variants. So what evidence can you show that banning those travel from those 10 countries in particular, and no others, is actually helping Canadians?
I would probably want to turn that very soon to Dr. Tam. I think Dr. Tam and Dr. Njoo eloquently and clearly explained why we wanted to have measures targeted to the 10 countries now, and another set of measures that are universally useful, that are universally important to delay, not stop, but to delay the importation of the variant into Canada. So one set of measures for countries where we know that there is significant community transmission and where it might not be documented internally, but we see obvious external signs that this community transmission exists because there is significant level of exportation of variant Omicron-infected people outside of those countries. And for the other countries, we knew from the start, yes, it did start in the UK and then in the Netherlands, and then we knew from the start that it would eventually occur in almost all countries. So that's why the measures we announced on Tuesday, the testing and the quarantine measures on arrival, we knew that these measures would be the best measures to protect the health and safety from a broader, a more universal approach. Dr. Tam, I may have cheated and said things that you would have been even better to say, but let me perhaps invite you to step in if you wish.
Yes, I think the minister explained things really well. At the beginning, you have to act fast and then reevaluate what's going on. At the same time as I also felt that broader approaches are appropriate because you just don't know where this variant is, and some countries don't have the capacity to detect it. So I think initially what we looked at was the actual epidemiologic situation as we know it, but also take into account abilities of countries to detect and respond as well. And then the country's vaccination coverage, the numbers of exports that the countries have had, in particular those who haven't yet reported their domestic cases. So if they exported without having detected their own cases as yet, but also the positivity rates at our border testing programs was taken into account. I don't think it was any surprise to people that Nigeria was on the list just because not only did we detect our initial travelers who are cases from Nigeria before we were able to communicate back to Nigeria that they may have more cases on their hands that they haven't yet detected, but also because the positivity rate of the travelers coming in from that country was quite high compared to everyone else. And Egypt was essentially in a similar situation, although the test positivity rate at the border wasn't quite as high for Egypt. And Malawi also exported to others. So it's not just the epidemiology, but their ability to detect and respond, and our confidence in that their case ascertainment within the country. And then the volume of travelers was also important. And so it's a sort of composite picture we were trying to do. But let's remind everyone that Canada had not let go of broad-based measures. We, like many countries, but certainly we had not let go of the pre-departure test for everyone, whether you're vaccinated or not vaccinated. That is universally applied, doesn't matter which country you come from, and with some exemptions, but they're very small. And then we still had all the testing for the unvaccinated travelers, where you will have a greater chance of also mandatory random testing on the vaccinated individuals. So those were all actually in place. Now we're just trying to ramp up the testing even more for those who are vaccinated. I think testing can do two things, to satisfy two objectives. I think whatever we're doing is delaying the spread, not preventing it altogether. And I think the system that we have already in place is a great surveillance system. It is not there to catch every case, but it will give us signals to know which other country is at greatest risk to Canada, for example, through that testing. So you're not testing everyone, but enough samples that you can start detecting hidden route chains of transmission, and then that informs your next set of measures. But all to say, though, that we do have to re-examine these measures almost every day. I mean, I think we need to be flexible. And if the situation changes, we don't think this list is applicable, for example, we need to be prepared to scale it down or up.
Merci. Non, juste une seconde. En fait, il n'y a pas de traduction. Raphaël Pirot de l'agence QMI et ensuite Abigail Beman de Global.
Bonjour, Monsieur Duclos. Donc, le temps des fêtes approche et les rassemblements à l'intérieur, ça dépend des provinces. Au Québec, par exemple, c'est 10, mais il y a une augmentation de cas en ce moment là, qui se passe. Et je voulais savoir, vous, premièrement, est-ce qu'il y a une approche qu'on pourrait prendre au niveau global au Canada? C'est quoi votre message avant les fêtes? Et savoir si vous aussi, vous seriez confortable au Québec avec une rencontre en famille de 25 personnes?
Bien, j'aimerais beaucoup avoir effectivement une famille de 25 personnes chez moi. Là. J'ai 35 cousins, en fait, non, j'ai 45 cousins, 24 oncles et tantes, j'ai mes parents, évidemment, 2, j'ai des frères, des sœurs. Donc, oui, mais juste un peu pour vous faire sourire, parce que, Raphaël, vous avez posé la question en souriant aussi. Mais c'est clair que, pour être plus sérieux, le rôle du gouvernement canadien, c'est de fournir la meilleure information possible, y compris des informations sur la situation internationale. On est en contact régulier avec nos partenaires étrangers qui reçoivent nos informations et qui nous transmettent les leurs. Et pour l'instant, tout le monde s'entend que la vigilance est le mot-clé. On veut éviter de paniquer, mais on veut reconnaître que ce nouveau variant a des caractéristiques préoccupantes. Et c'est un message qu'on envoie aux provinces et aux territoires en sachant qu'ils vont utiliser toutes ces informations, en ayant confiance qu'ils vont faire les meilleurs choix pour leurs citoyens.
D'accord, merci. Et donc, justement, on parlait de messages que vous voulez envoyer. Quel message voulez-vous envoyer aux étrangers, par exemple, quelqu'un qui veut venir visiter la famille au Canada, il faut qu'il passe un test, isolement pendant 3 jours. Est-ce que, par exemple, la famille qui reçoit la personne va devoir aussi s'isoler pendant la période de 3 jours dans l'attente du résultat? Et accessoirement, quel message voulez-vous envoyer aux étrangers qui veulent justement venir passer le temps des fêtes ici au Canada?
Bien, je pense que les gens qui vont venir au Canada vont devoir s'informer des mesures qui sont en place et des mesures additionnelles qui pourraient changer au cours des prochaines semaines. Souvent, les gens, évidemment, planifient leur voyage un peu à l'avance, mais ils ne savent pas à l'avance quelles mesures vont s'appliquer. Alors, on a vu, dans l'espace de quelques jours, on a dû augmenter significativement les mesures autour de la frontière, mesures frontalières en matière de tests et de quarantaine. Et ces mesures pourraient effectivement changer à nouveau dans les prochains jours, les prochaines semaines. C'est ça la vie avec la COVID-19.
Good afternoon. On the question of antivirals or the announcement of antivirals, when vaccines were first introduced, the messaging from the government was that this was the way out of the pandemic, this was the way forward. That seems to have changed somewhat. I'm wondering if antivirals take that on. Are antivirals the way out of the pandemic?
So thanks for the question. I think that the way to look at antivirals is to complement. It's another tool that we have available in order to fight this fight against COVID-19. So it in no way takes away from the importance of ensuring that we get the vaccinations, but it is an important tool because it will help prevent those that do get infected with COVID-19 from having the serious effects and impacts, which ultimately put strains on hospitals and healthcare providers. So the short answer to that is that this is absolutely to complement vaccines, and it's just another tool in the toolbox, but an important one.
Thank you. Oh.
If I can add briefly to what Filomena just said, this is a fourth tool that we're adding to the toolbox. The first one was quickly PPE, personal protective equipment, then came test, then came vaccines, and now we have therapeutics. And this morning I had a meeting with Minister Elliott, the health minister in Ontario, and we recognize obviously quickly that there will always be, unfortunately, people that will be infected with COVID-19, and some of them will have severe symptoms, and it's a lot better to avoid these people having to go to a hospital, and for all sorts of obviously personal and public health reasons, and that great news that Filomena shared with us this morning is a very significant step in further enhancing the tools with which we can use over the next months, possibly even years, in order to protect both the people and the healthcare system.
And on the question of arrival testing at the border, I hear you talk about how you're increasing testing slowly. I'm wondering if there have been any conversations with labs about increasing the ability to process those tests, and if you have any goal time for turnaround for those tests. How long should Canadians be prepared to wait?
Thank you. Yes, we obviously have had to work with labs of all sorts to be able to ramp up this capacity over the last few days, and we'll be able to do that even more as we move to 100% testing for all air travelers into Canada, except those coming from the United States. This being said, we're also in conversation with provinces and territories because they also have not only significant but superior lab capacity in Canada. That lab capacity has increased considerably over the last month, in part because we invested significant federal resources into building provincial and territorial lab capacity. So we are in conversation also with provinces and territories if at some point, as if we expand our measures to the land border with the United States, if at some point we need to very significantly increase lab capacity in the country.
Tom Perry, CBC, ensuite Catherine Lévesque de la Presse canadienne, puis on va passer au téléphone.
Hi, Minister Duclos. I wonder if you could, what's the biggest obstacle you're facing in trying to get this airport system, the testing system at the airport, up and running? What's the biggest problem you've got to solve to get it going?
Well, there is, as we've mentioned, lab capacity, how to increase by a total of 50% the total capacity of tests in Canada over a short period of time. That requires using test capacity, lab capacity that wasn't used by the federal government. The second thing is around, obviously, human resources to distribute and to distribute tests and to swab people at airports. And the third thing is about the physical space that is necessary for people to be swabbed at airports. There are airports in Canada where there is physical space, free, easily and quickly accessible, but there are other airports with which we are currently working to help them free up the physical space that is needed when people enter Canada.
earlier this week about how some travelers might get take-home tests. Could you explain how that's going to work? Because I'm not exactly clear how that system's going to work.
Well, that's already working in place for some time. So what happens is that people are registered, they are given a test, given information on how to bring that test home and do the home test. They are, in almost all cases, able to connect to a web application where a nurse or another trained person is able to help the person do herself or himself the test, and then that sample is sent by courier to a lab, and then it's processed as quickly as possible.
Bonjour tout le monde. Bonjour, Monsieur Duclos. Je voulais revenir sur les médicaments antiviraux que votre collègue a annoncés. Je me demandais si vous en aviez parlé avec vos collègues des provinces. Comment est-ce que les provinces et les territoires vont les utiliser, ces médicaments-là? Et est-ce qu'ils seront pour... bon, vous avez parlé d'un outil. Est-ce que ce sera pour les non-vaccinés ou est-ce que ce sera pour les personnes vaccinées, ces médicaments-là?
Oui, j'en ai parlé avec eux. On en a parlé ensemble mardi soir. Parce que je voulais qu'ils sachent là, un peu à l'avance que cette bonne nouvelle que Filomena a annoncée aujourd'hui arrivait. Et c'était une nouvelle là, qui a été très bien accueillie par les provinces et les territoires. Alors, la raison pour laquelle c'est une très bonne nouvelle, c'est qu'il y a des tests qu'on appelle antiviraux qui existent maintenant, mais ce sont des tests, mais pas des tests, des médicaments antiviraux qui existent maintenant, des traitements, mais ce sont des traitements intraveineux. Des traitements qui doivent être donnés dans un contexte hospitalier. Et ça, bien, c'est compliqué pour le patient, c'est compliqué aussi pour l'hôpital. On connaît les conditions difficiles dans lesquelles les infirmières et les médecins travaillent dans les hôpitaux. Donc, beaucoup de ces gens qui auraient pu recevoir ces traitements intraveineux ne pouvaient pas les recevoir pour les raisons que je viens d'expliquer, la capacité des hôpitaux, mais aussi parfois l'éloignement des gens par rapport aux hôpitaux. Donc, ça réduisait la rapidité d'accès à ces traitements. Alors, la bonne nouvelle maintenant, ce sont des traitements oraux. Alors, des traitements que les gens prennent de manière orale. Ce sont 10 doses de ce traitement sur 5 jours, donc 2 doses par jour que les gens peuvent prendre à la maison. Et ces doses réduisent, on attend la décision évidemment de Santé Canada pour avoir les chiffres précis, mais peuvent réduire de manière considérable le risque d'hospitalisation de ces patients, qu'ils soient vaccinés ou non vaccinés. On espère évidemment que tout le monde soit vacciné, mais de toute évidence, là, des gens qui ne sont pas vaccinés encore au pays, et ces gens-là se retrouvent malheureusement avec souvent des conditions de COVID-19 plus graves que les autres.
Merci beaucoup pour les précisions. Puis, les docteurs en ont parlé un peu plus tôt aujourd'hui, mais maintenant, au pays, on a 11 cas d'Omicron. Je me demandais si vous aviez le détail, soit vous, les docteurs, sur finalement la répartition par province, là, où se trouvent ces cas-là.
OK. Je vais me tourner vers Dr. Njoo ou Dr. Tam. Vous avez sûrement entendu la question. Est-ce qu'on a les derniers chiffres sur la répartition des cas de variant Omicron au pays?
C'est Dr. Njoo. Ce que je peux dire, à date, on a 11 cas signalés déclarés par les provinces et territoires qui sont liés avec le variant préoccupant Omicron. Ce que je me souviens, c'est un de la Colombie-Britannique, 3 en Alberta, 6 en Ontario et 1 de Québec. Mais c'est un chiffre qui peut toujours être mis à jour parce que c'est évolué et les provinces et territoires on continue à faire les suivis des contacts et tout ça. Mais pour l'instant, c'est 11 cas.
Merci. On aime l'efficacité dans les réponses. Continuez comme ça nous donne plus de questions. On s'en va au téléphone, opérateur, opératrice.
Thank you. Merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Dan Gromet from Global News Edmonton. Please go ahead.
Hey, this question is for the health minister just about the new testing requirements. And I apologize if you've already answered this in some way, but I'm just curious about connecting flights within Canada for people, travelers returning from foreign countries not named the U.S. So as an example, if I'm coming back from Mexico, my point of origin is Calgary. That's assuming where I get the test, but I have a connecting flight to Edmonton. Can you just go over, again, where do I get the test? I assume it's Calgary. What kind of test is it? And where are travelers expected to isolate if they have that test yet they have a connecting flight to another city, or maybe more than one?
Thank you for the question. That depends on your vaccination status. If you come into Calgary and you're vaccinated, you're either swabbed or given a test at the Calgary airport, and then you can move on since you are vaccinated. And the reason that you can move on is that being vaccinated, you are not in contradiction with the November 30th requirement to be vaccinated to be flying in Canada or outside of Canada. If you're not vaccinated and you come into Calgary, you'll still go, obviously, and have a test on arrival, but then you'll need to stop there and wait for your test result. And it's only then that you'll be able to move to a safe quarantine place.
So just to clarify, if you're vaccinated and you carry on to Edmonton, you don't have to isolate when you get back to your final destination, or do you?
But you need to isolate once you get to your final destination.
Opérateur, prochaine question.
Thank you, merci. The next question is from Aidan Cox from BBC News. Please go ahead.
Hi, I was actually just going to ask the same question here, but I guess another question I thought of was who pays for these tests? Because I know that there's private lab clinics that do testing. Is this something that the government is going to cover for travelers, or will this be an expense that you have to cover yourself?
Well, thank you. Now, there are three types of tests that travelers will want to consider when they think about leaving Canada. So the pre-departure tests out of Canada, because there are some countries, including the United States, that do require pre-departure out of Canada tests before entering into another country. That's paid by the person. The pre-arrival test to come back to Canada, that's also paid by the person. The test on arrival, the day one test on arrival at the airport, that's covered by the federal government.
Okay. One other thing, sort of related to the connecting flights question, what's the case if there's a layover? So, similar example, if you fly in from a country aside from the U.S. and you have to connect in one city before moving on to your final destination, can you have a layover of, say, 1 or 2 days before you end up carrying on to your final destination? And if so, what's the process that you have to follow in terms of, just isolating between when you land at that initial Canadian airport and then getting back into the airport to carry on to your final destination?
Yeah, I'm sorry. The question is a bit complicated, and I prefer not to give it precise answer because there are so many parameters that seem to be taken into account. It's not a blame. It's just I think a fact that you have in mind an appropriate example which might be quite specific to a particular circumstance.
So there's lots of layovers that happen. I mean, if you have to overnight in, let's say, Toronto and then carry on to, like I'm in Fredericton, what's the guidance there?
Okay, so I'll ask my team to make sure that you get the right answer. They probably will need to verify with our colleague, Minister Algabra, because there are also transportation rules of which we should be also mindful.
Thank you. Operator, do we have more questions on the phone?
Once again, you may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. There are no further questions at this time. Nous n'avons plus de questions pour le moment.
Est-ce que on peut peut-être prendre une dernière question de la salle? Marika, just one question, please.
Okay, thank you. Mr. I just wanted to confirm, the airports keep telling us that they are not yet telling passengers to isolate. I understand you're saying that the tests are being ramped up, but where in Canada, what airport is any traveler who is fully vaccinated being told to isolate until that negative test? Where is that happening? Because we can't find any examples of it. It's not yet on your website. So where is that actually happening now?
Well, the requirement to isolate or to quarantine upon arrival, that is being handled by the Chief Public Health Officer, so Dr. Tam, who is on the screen. That is requiring her to work with border officers and local public health officers. So the responsibility is shared by both border and PHAC officers. So, and yeah, I'll turn to her in a moment. So people should expect that if it's not happening now, yet it will happen. And they need to listen to the advice and sometimes the requirement that border or PHAC officials will share with them. Anything you would like to add?
So basically, the requirement, if you're from, it's quite complicated. I think we're going to have to put up some tools on the website so that travelers can actually figure this out, like we have done in the past with all the border requirements. And it depends on whether you're from the 10 countries listed, and then figuring out whether you're vaccinated or not. So the ones who are unvaccinated, of course, we all know what happens to them. The ones who are unvaccinated and you're from those 10 countries, you have to isolate at that point of entry. Essentially, you're waiting for your day one test. That isolation can potentially happen at home or at a quarantine facility, depending on the assessment of your quarantine plan. So everybody has to have a quarantine plan already specified before you come in, whether you're vaccinated or not. That's just broadly speaking applicable to every traveler. So in that circumstance, you already have a quarantine plan. You should definitely have thought about it. And then you get tested. And I think it's an evaluation of your place of quarantine and whether it's a suitable place. And that will be done by the officers on the ground at the airports. And theoretically, it actually should be happening in all airports where travelers from these countries come from.
C'est ce qui met fin à cette conférence de presse. Merci beaucoup tout le monde.